Welcome to The Movement, the podcast where we celebrate 165 years of impact and look ahead to 165 years of empowering our community with the YMCA of Greater Kansas City. Join us as we share remarkable stories from individuals whose lives have been transformed by the Y across the Kansas City metro. From members and volunteers to community leaders and associates, their journeys inspire us to keep moving forward and making a difference. Get ready to be inspired by The Movement. 165 years of impact, 165 years ahead. Let's go. Welcome to The Movement. I am your host, Mark Hewlett, and we are coming to you from the Platte County Community Center South here in Parkville, Missouri. Platte County South is one of two community centers owned by Platte County and operated by the YMCA of Greater Kansas City. In fact, this private-public partnership between the Y and the county began over 20 years ago and was an innovative model in how the YMCA served new communities. It actually was a game changer that showed how two organizations could collaborate and bring their strengths, the county's capital investment, and the Y's operational experience and expertise to maximize community support and impact. Our topic today is Parkinson's disease and the YMCA program Pedaling for Parkinson's that is providing support for this chronic disease. I am joined by Sarah Srock, who leads the YMCA's healthy living programs here at Platte County South, and Dr. Mohammed, a clinical associate professor for the Parkinson's Disease and Movement Disorder Center at the University of Kansas Medical Center. Welcome to today's conversation.
Thank you so much, Mark.
Yes, thanks for having us.
Delighted to be here.
Yes, great. So we're going to jump right into this. We got some fun folks behind us here that are pedaling their way. I think the setting is awesome for this conversation. They're welcome to wave and say good afternoon. Thank you so much. So this is a question for both of you. So I'll start with you, Dr. Mohammed. Let's start with some of the basics. What first inspired you to get involved in Parkinson's work, whether through medicine or relationships? Just how did you get started in this work?
So when I started medical school back in 1999, I'm old enough now that I can actually say that I went to medical school back at the turn of the century. And so I had no idea that I would become a neurologist. But one of the very first influential things that happened to me is that Dr. Raj Pahwa, who's the director of our Parkinson's Disease Center of Excellence at KU, he actually came to our first-year medical school class, and he was showing a cutting-edge new treatment that had been developed called deep brain stimulation. And it turned out that KU was one of the first 3 programs in North America to do this treatment. And I thought, well, that's intriguing. People could have surgery and then they could move better. But then when I started to do rotations in different fields, I really started to become attracted to neurology. I liked the detail of it. I knew that there would be a lot of developments over the decades ahead. And when I became a neurology resident, I fell in love with movement disorders once I saw that there were a lot of actual treatments that people could have, and there was a lot of focus on mobility and rehabilitation and allowing people to perform and function better. And so those were some of the things that led me to pursue movement disorders and becoming a Parkinson's disease doctor.
Yeah. And Sarah, how did this is your brainchild here at Platte County South, Pedaling for Parkinson's, and the conversation, what's happening behind us here. But how did this, what's your background and what got you excited about bringing this program?
Well, actually, it was my grandfather who inspired me. In the 20 years that I've worked for the YMCA and have worked in health and wellness, he actually died in 2014. But prior to that, he had been diagnosed with Parkinson's. And so got to see firsthand just some of the different things that he had to go through. My grandpa was one of those strong individuals his whole life, got his hands dirty, and I saw what had happened over time. And at the time, I didn't have the background or much knowledge on the disease. And so when he lost his life, I just found it to be part of my mission to help those that are impacted and learn as much as I could about the disease. And so working for the Y has been very exciting because we get those opportunities to help individuals with chronic disease in general. So when I first learned about Pedaling for Parkinson's, I was on top of it, just trying to learn more about it and the research behind it. And so just very thankful that the Y has blessed me to be able to bring this program here.
And Dr. Mohammed, for listeners who may not know, what exactly is Parkinson's disease, and how does it affect people's daily lives?
So many people who first hear about Parkinson's disease will think about ways in which their movements and their mobility are affected. So one of the things that a lot of people notice is that, or most people with Parkinson's notice, is that they have shakiness or tremor. So, and that usually means that their body part that's moving is moving in opposite directions. And so this usually happens at rest. But sometimes some of the more obvious things that show up gradually are a sort of slowness of movement or a decrease in movement. So if somebody's doing the same repetitive movements over and over, like opening and closing a fist, not always are people slow. Sometimes they may just start out with very big movements, but then they gradually become smaller and slower. And when we see that, that's not because there's a problem with the nerve or muscle itself, like in the hand or in the foot, but because of the overall tone of how the brain is coordinating automatic movements. Over time, people can start to have more balance problems to the point where even if they lean over too far or inadvertently get bumped or knocked over, it's very easy for them to fall. There can also be a lot of problems with stiffness, especially in not just in the muscles, but even in the joints. And so this is different than having arthritis or a muscle problem. It's because the overall tone in the brain is starting to increase, almost as if you were turning up the resistance on, wait for it, a stationary bicycle. So that stiffness is rigidity. And so these are some of the more common features that people with Parkinson's have. But in many cases, it's the non-motor features that are very bothersome to people. And these are features that we don't normally see in a person, but sometimes people lose their sense of smell. Sometimes they can have more problems with constipation. They can have more problems with bladder function. Even over time, some people will have problems with fatigue, thinking and memory, mood, anxiety, things that people who have been adults for a long time may never have had before. And it's actually a part of the disease process, not simply a matter of, I'm struggling with this or I'm having a hard time coping with Parkinson's disease. So it's a very multi-systemic disease process.
And then how do you identify it? I mean, what is the test? I mean, it sounds like there's so many multiple symptoms that how do you define it?
So over the years, most of the people who are diagnosed with Parkinson's disease are diagnosed clinically, which means that if they see a doctor or provider who is familiar with neurology and movement disorders, they can ask about the story about how they've been functioning or not functioning well. They can do an examination and look for signs of tremor, rigidity, slowness of movement or incoordination, which is called bradykinesia, postural instability, and sometimes other things like freezing where the feet get stuck to the floor, or some people have a lot of forward flexion of the trunk. These are some of the features that they can look for. And there are various examination techniques, like moving the hands or moving the legs, looking at eye movements, to be able to build the case for, yes, I really think you are starting to show signs of having Parkinson's. Now, in more recent times, there have been other technologies that have been developed that can be useful in also increasing the chance of a successful diagnosis. Over 10 years ago, there became a special type of PET scan, which looks normally at how cells are active or inactive. And so when people, for example, have cancer that has spread in their body, they might have a PET scan to look to see what parts of the body has the cancer spread to. But there's a special type of PET scan called a dopamine transporter scan that specifically looks for the amount of a chemical we all have in our brains called dopamine. And if that dopamine is low in the movement areas of the brain, the substantia nigra, or the other parts of the basal ganglia, then that scan can show that the person's low on dopamine, and that can increase the chances of a correct diagnosis. Even in the past several years, there has also been a skin biopsy that has been developed and is now commercially available that looks for an abnormal protein called alpha-synuclein that is misfolding and building up in brain cells. And so if that's actually found in the skin, even with at least 93% sensitivity, this skin biopsy can tell that somebody's developing Parkinson's disease, potentially even before they develop motor symptoms. And so that's very hopeful, because if we can find out that people even might have Parkinson's disease early ahead of time, if we had treatments that would slow the progression of Parkinson's disease, that would be a very hopeful next step.
That's a great answer. Thank you for sharing that. What, Sarah, we'll talk about pedaling for Parkinson's a little bit, but what other ways does the Y step in to support those living with Parkinson's, just practical everyday ways that you've seen, and especially with our friends back here?
Well, I think most can agree that exercise is medicine. And so we offer a lot of medicine here at the YMCA, and in forms of all different group exercise classes and seminars. We have a Parkinson's support group. We're really big on that social aspect because we know how important that is in your health. And so I feel like if you come here at the YMCA, you're going to find something that is fun to you, because we want exercise to be fun. And something that I think you'll fall in love with. And so I am very happy to work at an establishment where we have all sorts of activities, whether it's in the water, whether it's on land, whether it's on a bike, whether we have outings. We have groups of individuals who do things together outside of the Y, which is the goal. And so there's lots of activities here that we can offer.
Yeah. So tell us about pedaling for Parkinson's and what makes it different than just hopping on a bike?
That's a great question. Pedaling for Parkinson's is offered 3 days a week, and each class is up to an hour. And so what the research or evidence has shown on cycling would be having our participants reach about 75 RPMs or higher, or forced exercise. And so it's more of a steady state. And we also know that that could be somewhat fast for others. So if we can just get them outside of their comfort zone and get them where they're pedaling at a faster rate, that's going to help them. It also shows that if you can participate those 3 times a week for an extended period of time, it can reduce symptoms up to 35%.
Wow. Dr. Mohammed, beyond just the movement side of things, what about Parkinson's impact on emotional health and family life, maybe? Just some of those things that go along with the chronic disease.
It's so important to be focusing on those aspects. As I mentioned earlier, people who are not new to being an adult, now many decades into adulthood, often are starting to develop unanticipated change. And whenever there is change that is not desired, that change can be associated with a tremendous feeling of loss of autonomy, loss of ability, loss of hopes and dreams. And so it would be normal and expected that anybody, no matter how successful or stable their mental health is, this would be a challenge for them. And life has many ups and downs, but people with Parkinson's disease often struggle with being able to adapt and cope in healthy ways. And it's not because of a lack of inherent ability. It's often because they're thrown for a loop, and it really sends people along a pathway where if they don't have positive ways to interact with family members, with loved ones, with friends, being able to be to function even and to be able to continue to work and have a meaningful employment is very important for a lot of people. I think sometimes we think about Parkinson's disease as being a disease in older people, but that's not necessarily the case. In fact, the average age for Parkinson's disease is usually sometime in like the mid to late 50s. And there are certainly many people, even in their 40s, who have Parkinson's disease. It's not considered young onset unless they're younger than 40 years old. And so, I think that's one of the beautiful things about this program is it gets people together. They're engaging in something that's positive, which is exercise. There's community, there's togetherness. And I think these are really an important part of trying to bridge some of the gaps that people have when they're dealing with some of that emotional loss. But I want to be clear that it's not just the mental component. Even losing dopamine in the brain or other transmitters, neurotransmitters like serotonin, norepinephrine, acetylcholine, can also chemically put people into situations where they are more likely to have anxiety or panic, depression. And unlike somebody who maybe, we've all known people who maybe from the time they were even teenagers, they just sort of seem to have more negative thoughts, or maybe they're not very effective at coping with difficult situations. People with Parkinson's disease, if medications can be used to work on their brain chemistry, many times they actually respond very well. And so sometimes I feel like we have to get past that stigma of, oh, you're depressed because you have Parkinson's and you're just sad about your diagnosis. And it's not that. It's actually that the brain changes would cause anybody to have those types of feelings, which are normal and expected.
What I appreciate both the comments that both of you made that we've got this support group, that we're talking about community, and we're coming to a place where there are gaps that can be filled by a program like this. And I think that strikes so well with the why, our strategic direction being the center of community, a place where people are coming and feeling like they can belong no matter what they face. And I think this is such a unique program and such a support program that does more than just the mental side of it or the physical. I mean, it's taken all three pillars, right? It's spiritual, it's mental, and it's physical. So I appreciate hearing that from both of you. Sarah, what's this is a new program. So what's been the response in the center as people find out about this program?
Exciting. I've had a lot of positive feedback. I know some of our participants who come to the support group have been waiting for this. And so the planning has taken a while, but we wanted to make sure that we rolled it out just right and had everyone trained and ready to go. So I've actually received a lot of positive feedback. I will say what is really inspiring is just seeing them walk in the doors and get on those bikes. Because spin class in general is pretty intimidating. And
Yeah.
then they come in and they start going, and some of them may not have realized that they could do that. And so to see them come in and start riding, it's pretty inspiring.
Yeah. Anyone come forward and talk, as they're discussing the program, and have they expressed what they hope to achieve out of the program? Have you heard these hopes and dreams that what the program can do for them?
So some of them, once they hear how it has the capability of reducing symptoms while they're in the class, that gives them some hope. And so the feedback and some of the excitement is that piece of it, just being able to reduce some symptoms. But the other piece of it is it's an exciting class where they can go with other people, where they can talk about Parkinson's, or they can just talk about life. But they all sort of have that one thing in common. So they can come in and that's there if they choose, or they can just come in and sweat and not talk.
Yeah. And Dr. Mohammed, from the medical perspective on the program, this high cadence and pushing people past the limit, what's the how does that work with brain and motor function? I'm trying to put that together. So maybe take us a little bit down the medical side of it a little bit.
So I think a lot of this really goes back to the research that Dr. Jay Alberts did. Dr. Alberts is actually a PhD scientist. He's currently the vice chair of innovations, which is kind of an interesting title,
Sure.
at the Cleveland Clinic Foundation. And he ended up doing the original study looking at forced exercise. And his background is actually in kinesiology, which is just like the study of human mechanics for like motor performance. And it's really more related to like athletics and sports performance. And so one of the things that they found was that he and his team in his laboratory is that when people go through that process, especially when they get to those faster rates, where it's almost a feeling of like that feeling people have when they're out of control, that feeling is associated with release of dopamine, kind of like anybody who might have even a little bit of thrill-seeking mentality might have, the same way as people who enjoy roller coasters or
Sure.
A piece of chocolate or some ice cream, that dopamine rush that you get. Nowadays, we have people constantly scrolling on their phone and getting little micro hits of dopamine all day long. So Society keeps evolving more and more dopamine hits. But what they found is that having that dopamine rush will sort of make up for the fact that people with Parkinson's tend to have lower levels of dopamine. And so by the time somebody might have shakiness or tremor or slowness of movement or rigidity, usually at the beginning of those symptoms, we've already lost about 60% of the dopamine producing cells in our brain. And so being able to have extra boosts of dopamine through natural things like exercise can be a healthy way to try to get things moving again. But it also, the fact that you get the revolutions per minute, the RPMs get up to as close as you can to 75. Some of that also is good for cardiovascular fitness. So there are a lot of other blood vessel related changes that may have a downstream effect. And people just neurologically, not even just Parkinson's, but their brain function and their brain health is better. And so all that circulation, you brought up spirituality, all of that exercise sort of cleanses away some of the sins that have been building up in blood vessels over time. And so that's one of the things that I think can make people have a better result.
And Sarah, I mean, in your investigation of the program, before you're kicking it off here, I'm assuming you've talked to other Ys or other program leaders across the country. And what kind of success stories are you hearing about the program?
Yes, so I actually first learned about this when I worked for the YMCA of Greater Providence in Rhode Island, and actually helped to roll it out there, and was super excited about it. My grandpa had already passed, and so he was not aware of it, but I envision that he can see me doing the work. But I have an amazing success story, and I think about him often. His name is Michael. He was actually diagnosed in his 50s. He was this promising architect, and did a lot of activities, physical and whatnot. And of course, by the time I met with him, it had progressed, and so he had a neck brace on because he had a hard time holding his neck up. He used a walker, and he walked very slowly, and it was hard to hear him sometimes. And so he was very excited to learn about pedaling for Parkinson's. I was a little nervous because he was very unstable on his feet. So he would come in and he would be there 3 days a week. He wouldn't miss. And one day when he was riding the bike, he pushed his hands off the handlebars, sat straight up, and started singing loudly. And I had never seen that before. And I ran over to make sure he was okay, and he was perfectly fine. But it was just phenomenal to see him transform. And as you know, he may not do that the next time, but he could in a week or so. But just to see that those 30 seconds of him changing and having fun doing it, that's a huge success.
Wonderful. That's a wonderful story. Dr. Mohammed, can exercise actually slow down the progress of the disease, or is it truly just mainly ease symptoms?
So the best evidence we have is that it eases symptoms. There are a lot of different studies that are being done to look at different types of exercise and the dose, almost like a medication treatment. The amount of exercise, what types of exercise. One of my colleagues and mentors at KU, Dr. Jeff Burns, who I know you know personally,
wonderful human.
His whole career has been focusing on exercise in Alzheimer's disease.
Yep.
And so the same is happening with Parkinson's disease. We don't have a lot of solid evidence today in 2025 that if you would just do A, B, C, or X, Y, Z, that if people who would do that versus people who wouldn't do that their outcomes would be different. But that's because of the complexity of Parkinson's disease. There are environmental factors. There may be genetic factors for many people. But overall, I think most people in neurology would agree that if a person had overall better health, which includes a healthier exercise ability, that overall, on an individual level, people's outcomes could be better. But it's difficult to say, if you would just do this, that's going to translate into you're going to live this much longer on average, or you're going to have a slower progress. So that's where we need more research.
Sure. Sarah, so we've kind of talked about how this class works. It's a group, right? And doing group exercises at the Y. Can you talk specifically maybe how that creates a little bit more impact than doing things alone?
Yeah, we're not always motivated when we're alone, and we don't have that person yelling at us, "Come on, you can do this," which is what our instructors love doing. And so having more of a group setting environment when you're getting to exercise and others are feeling similar, probably exhausted, sweaty. But when you have a group environment, sometimes you push a little harder. You also have that accountability. Now you've made friendships and you've built these relationships, and John is expecting Jeff to be there for him. You've built this where that you have someone waiting for you. You have someone there that's going to push you and you're going to push them. And so, yes, while there's a time and place to do things individually, sometimes it's just better to be in a group.
Doctor, you slightly touched on it, but what about new treatments and research and breakthroughs that are happening? You talked a little bit, but is there something to expand on that a little bit? Other things that may be happening?
So for many years, dopamine being low in Parkinson's disease was the primary focus of most of the treatments. So between levodopa, dopamine agonists, which stimulate dopamine receptors, medicines that slow down the breakdown of dopamine, medicines that keep your dopamine around a little bit longer. These were the major treatments that we had over the years to help people. Now there's been a lot more focus on a lot of the non-motor aspects and making sure that we have better treatments for constipation, bladder dysfunction, sleep quality. Some of them are not specific for Parkinson's disease, but they are applicable to a wide variety of neurology conditions that can affect these problems. The thing that I think I'm the most excited about is that we're actually looking at taking stem cells, which are cells that have not become brain cells yet, or liver or kidney or bone cells or skin cells, and actually programming them and then implanting them neurosurgically into people's brains in a way where the technology has improved a lot. Because when I was a fellow becoming a movement disorder specialist 17 years ago, they had tried to do some research with stem cells, but the results were not very successful. But now that the science and technology has improved considerably, this is a possibility that we may slow the progression of Parkinson's disease in a way where instead of people living maybe 15, 20, 25, 30 years with Parkinson's disease, what if people could live 40 or 50 years with Parkinson's disease? That would slow down the progression enough where, as we all get older, people might have other health problems, and it might not even be that Parkinson's disease is what causes a problem. So that's a very encouraging and hopeful thing. Yeah. At any particular year, so even right now, there are well over 50 different phase 3 studies. These are studies that have gone past the, hey, I have a really great idea, maybe this will work in Parkinson's, and it turns out it doesn't work. These are studies that actually have gotten off the ground. They've already done phase 1 and phase 2 trials to actually show that the proof of concept works. And so we just need to make sure that there's safe treatments and try to narrow down a little bit about what the amount of the treatment might be, like how long should they be on it, or what's the dose. And so there are always a variety of these, and any number of them can be approved once they go through that whole process and are shown to be effective.
Sarah, I think in our conversation earlier, I heard you say that you have 10 instructors certified to work in this program, which is remarkable. Looking ahead, what's your dream for how the Y can expand this program?
Yes, before I answer, I want to take a second to acknowledge our participants have been writing now for about 30 minutes. And just like class, if you need to slow it down, get off your bikes and stretch it out, please feel free to do that. Because the class just started, we're only on week 2, and so I do want to make sure that they understand progression. And
as a good program director would be, thank you for making sure that they're safe.
Yes. So my vision and my dream would be for this program to be so successful here that it expands into our other Ys, because then that is expanding into other communities. Parkinson's is everywhere. It's just not here. And so I would love to see this in more of our Ys.
What kind of advice would you give to somebody that may be nervous about the class?
Right. So nervousness is such a natural feeling. And whether you have Parkinson's or not, it's still an uneasy feeling. I would say that if you're nervous, that's okay. We are very welcoming and accommodating, and we are here to meet you at your level. So we will help you get set up. We'll make sure that you're comfortable. You can come for 5 minutes and then leave and then build your way up to it. We wouldn't expect you to come in and ride for a full hour. And so just if you're feeling uneasy, that's so normal. Just come see us.
Yeah. Well, we only got 30 more minutes. You guys good? Just kidding.
I want to add to that, Sarah. I think that's a very important point, because a lot of people who have Parkinson's disease, even their family members and loved ones, friends, close friends, often notice that sometimes people start to lose that oomph, that sort of initiation. And the medical word for that is apathy.
Yep.
And sometimes apathy gets misconstrued as depression. But sometimes people, say, I need something to really kind of jumpstart. And so having that accountability, having other people that you can bond with, and to be like, I really like what you said, because it's like, if you can show up, it's unlikely that people will stay for 5 minutes. They might make it 7.5 or 10, but they'll stick around for a little bit. And I think that's an important part of is just showing up.
Always. What does success look like in the future for Parkinson's to you, Doctor?
Well, what I would like to see with Parkinson's as soon as possible is that the medications and treatments that we have available already are available to everyone who needs them. It used to be that access to health care meant whether or not you had insurance coverage or not. But it's a lot more complicated than that. Now we have people who absolutely can afford their medications, but it takes 8 to 12 months to get in with a movement disorder specialist. Or if you go to the hospital, you may not even be able to see a neurologist in your hospital. So access to care is one of the biggest barriers, because we already know that we have treatments. There are at least 29 FDA-approved treatments for Parkinson's disease. But many times, if you ask general neurologists who have a wide variety of experience and types of patients that they're working with, they might only be familiar with 10 to 12 of those treatments. And so if there might be a different medicine that would be a better option, or if there might be a better way to use the medicines together so that people are functioning better. I am on the board of the Parkinson's Foundation Heartland, and so I work very closely with them about education and different resources for patients, family members, and caregivers who are working with Parkinson's disease. And one of the things that I think would be the most meaningful is to be able to share that only 9% of people with Parkinson's disease actually have a movement disorder specialist. About 50% of people are actually seeing a general neurologist, which means that the rest of them are either seeing nobody or working with their primary care physician or like a nurse practitioner or PA. And so one of the things that I've been involved with as my role as a faculty member at the University of Kansas is trying to recruit and train medical students and residents to go into neurology and movement disorders, because that's such an important part, is being able to have people to get the treatments that they need. And then there are surgical treatments that many people are not aware of, like deep brain stimulation or focused ultrasound. And so it's always concerning when I know that we have this ability, but then patients are not familiar or nobody's really explained it to them.
Sarah, what's success look like for you? Fair to ask you. Maybe.
That's a hard question. We have so many great programs that I love here. And so success in my in my eyes, would be for all of our chronic disease prevention programs to be successful, and to continue to have the impact that we have on our communities. This program will always be very special
Sure.
to me. My heart is 100% in it, and I love these people dearly. And just the more that we can help them on this side of the spectrum is my goal, and I want to help them as long as I can. I'm not a medical profession. I chose preventative for a reason, and I want to continue to do what I can to just keep my promise to myself and just to the people that we impact.
Dr. Mohammed, do you have a hopeful message? A hopeful message for our listeners?
Absolutely. Anybody taking the time to listen today, and I hope that you take advantage of this program. I think that just in meeting the people who have been involved with this program, I see a lot of the right attitudes and mentality. I can feel the passion. I can feel the enthusiasm that they have. And I think people with Parkinson's disease need to be able, it takes a village. When we're children and we're growing up, it's not just our parents. We need teachers and coaches and mentors. And then somehow when we become adults, it's like, oh, well, you might need that or you might not need that. It's like, no, that's not true. It's the community, it's the togetherness. And I feel hopeful just, coming here today and seeing some of our people with Parkinson's disease participating in the program. And I think it's definitely worth it to come check this out and to try to be involved. You really have very little to lose. I mean, you're literally spending time, which is a very important commodity, but what you gain in spending that time is a tremendous benefit. So I really encourage people to check this out and to look into it.
And that, my YMCA friends and family, is Sarah Srock at Platte County Community Center South and Dr. Mohammed at the University of Kansas. Thank you both for being here. What an interesting and fulfilling conversation for me today. Thank you.
Thank you so much.
Pedaling with Parkinson's is one of the examples that the YMCA continues to commit to health, chronic disease management, and community support. YMCAs across Kansas City Metro also have programs, as you heard, in cancer survivorship, Alzheimer's, arthritis, diabetes, weight loss management. You can find more information at kansascitymca.org. Stay motivated, stay connected, and keep moving forward with us in the movement. Together, we're building a stronger community, one story at a time.
Thanks for spending time with us on The Movement. Visit kansascitymca.org for more information and follow the YMCA of Greater Kansas City on social media. 165 years of impact, 165 years ahead. Let's go.